Hello, everybody. My name is Mackenzie Rice, and I did my project on the effectiveness of the cues pause point procedure in reducing echolalia among children with autism. So echolalia is the echoing or repetition of words or sentences from another speaker. Echolalia is prevalent in children with autism, and it can interfere with their development of functional language skills. This current study investigated the use of the cues pause point procedure, CPP procedure, to reduce echolalia when asked yes and no questions with a child who has autism spectrum disorder. Specifically, my participant was a 7-year-old female who is diagnosed with autism spectrum disorder. Correctly answering yes/no questions is an important daily skill by being able to make decisions and communicate thoughts and feelings effectively. There are previous studies done that support the use of the CPP procedure in reducing echolalia, such as Valentino in 2012 displayed that the CPP procedure was effective in reducing echolalia of the instruction say, and Fox in 2004 as well displayed that the use of the CPP procedure replaced echolalic responses with trained stimuli. So the independent variable in this study is the cues pause point procedure, and the dependent variable is the percentage of echolalia that occurred during yes/no questions. The design that I used in this study is a single subject A/B design. So during baseline in the study, the participant was given the question of, is this while holding up a 3 by 5 inch common item picture card at eye level. The percentage of correct responses for yes/no questions was recorded electronically on a data collection app called Catalyst. And echolalia data was recorded on a paper data sheet. So the total number of trials was recorded and the frequency of echolalia was recorded to then calculate the percentage of echolalia occurring. So like I mentioned, like in baseline, a 3 by 5 inch common item picture card was presented. And once that was presented, I used an immediate gesture prompt towards the corresponding yes or no stimulus prompt. And throughout the sessions, the gesture prompt was faded back to the yes/no stimulus prompt cards. And then the stimulus prompt cards were then faded back or covered, so the participant wasn't able to read them depending on their correct responses with no echolalia occurring. So for the results during the baseline phase, we saw 0% correct responding of yes/no questions and 100% echolalic responses during yes/no questions, which we can see on the graph in the middle. And during the intervention phase, the participant was able to reach 100% accurate responses to yes/no questions and reduce their echolalic responses to 0%, which we can as well see in the graphs. So this shows that the CPP procedure was successful in reducing echolalia and increasing the amount of correct responses to yes/no questions. The CPP procedure could be a potential intervention to reduce echolalia among children with autism and improve their ability to communicate decisions and their feelings. Limitations to this study included only the use of one participant and setting. Refinements to the study in the future would be to use a multiple baseline design across participants to help show a stronger functional relationship between the CPP procedure and echolalic behavior. And then there are our references down there to the studies that were referenced. And that's it. Thanks for listening. Bye.